Welcome, everyone, and thank you for joining us today. I'm Nana Bennett, co-director of the University of Rochester's Clinical and Translational Science Institute and director of the Center for Community Health and Prevention.
And I'm Martin Zan. I co-direct the UR CTSI alongside Nana and also serve as the Senior Associate Dean for Clinical Research. Before we kick off today, I'd like to cover a few housekeeping items. Inclusion is important to us, so you should all see an ASL interpreter on your screen throughout the announcement. Thank you to today's interpreters, Ron and Chris, and Morgan Underwood, who arranged for them, for helping us to reach our deaf and hard of hearing community. Also thanks to Suzanne Paolo for arranging this conference. We will leave time at the end of the announcement for question and answers. Please enter your questions or comments in the Zoom question and answer box.
We're gathered virtually today to share some exciting news about the University of Rochester's CTSI that will affect our entire research community. But before we unveil that news, I wanted to talk a little bit about the CTSI and its long journey to where we are today. The CTSI is the research engine of the University of Rochester. It supports research teams across the university to help them translate discoveries made in the laboratory to treatments and interventions that improve patient care and population health, and to do it faster. The CTSI got its start 14 years ago when it was one of the first 12 institutions in the nation to receive a Clinical and Translational Science Award from the National Institutes of Health. At that time, the $40 million award was the largest NIH grant ever awarded to the university. Since then, this major funding source for the Clinical and Translational Science Institute has been renewed twice, once in 2011 and once in 2016, for 14 years of continued funding. In its 14 years, the CTSI has made big investments in our local researchers and community. Since 2006, we have invested nearly $8 million in early stage research aimed at improving the health of our community and improving how we do research. That funding supported 200 separate projects, many of which have given rise to further research projects, programs, and funding. Also, the CTSI supported 270 trainees across our many educational programs. This represents a $16.9 million investment in the next generation of translational researchers. As a testament to the impact of these investments, researchers and trainees who were supported by the CTSI have gone on to secure $131.8 million in external funding and have published over 1,500 scientific papers.
And in 2017, the University of Rochester CTSI was selected to serve as the central coordinating hub of the Clinical and Translational Science Awards program. That honor came with a $19 million award and the opportunity to establish what is now known as the Center for Leading Innovation and Collaboration, or CLIck. CLIck, which is housed in the CTSI, coordinates the efforts across the country of more than 60 of the nation's top biomedical research institutes that are part of the Clinical and Translational Science Award program. In its short tenure, CLIck has revolutionized how these institutions collaborate and communicate with each other, helping them share data, ideas, and resources, all with the end goal of speeding up research and improving health around the world. In this time of COVID, that kind of coordination is critical. The CTSI and CLIck are points of pride that put the University of Rochester in the vanguard of institutions that are transforming biomedical research.
All that brings us to today. to an institute that has nearly tripled in size and scope in just the past 5 years, with a team of over 100 faculty and staff. Last summer, our team wrote a grant proposal for our 4th Clinical and Translational Science Award. Despite writing that proposal long before the novel coronavirus had reared its ugly head in Wuhan, it was eerily prescient for the situation we are all in today. With the theme of research without walls, the CTSI will move beyond the physical confines of institutions to help researchers conduct studies remotely, integrate research with clinical endeavors, and break down barriers to diversity in our research workforce. Our grant reviewers must have had a touch of foresight as well. They awarded us a nearly perfect score of 11.
When we received that score in January, I remember thinking, barring some apocalyptic event, we will be funded. And we all know how that turned out. All joking aside, in these uncertain times, even a near perfect grant score couldn't guarantee that funding would be secure and the future of the U of R CTSI would continue. Even in the best of times, we typically don't get everything we ask for in these grants. Our past 2 renewals were cut by several millions of dollars, and the cut in 2016 shortened the grant by a year. But this year, despite the global pandemic and economic strife, the U of R Clinical and Translational Science Institute was awarded $24.3 million over 5 years. Very nearly everything that we asked for from the National Center for Advancing Translational Sciences at the NIH. This award will allow the UR CTSI to continue helping research teams turn their discoveries into therapies that improve health throughout the period until 2025. That will bring us a total over the lifespan of the UR CTSI of 19 years of continuous funding, a total of $132 million. And we could not have done this without you. It is a testament to the entire U of R CTSI team and the University of Rochester research enterprise that I'm able to share this news with you today. We also owe a deep debt of gratitude to our university leaders. University of Rochester President Sarah Mengelsdorf and URMC CEO and Dean of the School of Medicine and Dentistry, Dr. Mark Taubman. And to our state and federal elected officials for their unwavering support of our research mission. Several of our elected officials reached out with messages of support and congratulations. Senator Charles Schumer said, and I quote, "In the midst of the COVID pandemic, this federal investment is a shot in the arm to a frontline medical research institution in Rochester and their researchers who are taking medical discoveries out of the lab and transforming them into new real-world therapies and medical breakthroughs. This job-creating investment is enabling Rochester's best medical innovators to create the cutting-edge biomedical solutions that our nation needs to meet the healthcare challenges of today as well as tomorrow."
And from Senator Kirsten Gillibrand, as COVID-19 continues to decimate the health and safety of Americans, we must invest in biomedical research and clinical care to better understand and end this unprecedented health crisis. The groundbreaking Clinical and Translational Science Institute at the University of Rochester Medical Center has always been a premier biomedical research institute, and I am confident their expertise in public health will help New York State and the entire nation safely progress into a post-COVID-19 era. This critical NIH funding will fund essential research to combat this virus and develop a life-saving vaccine as we strive to keep every American healthy and safe.
And from Congressman Joseph Morelli, URMC has always been a leader in research, innovation, and transformative medical advancement. And this award recognizes the significant implications of their work. Now, more than ever, as we continue to respond to the COVID-19 pandemic, we see how essential research like this is truly to improving public health. I'm grateful for the groundbreaking work URMC continues to do, which has a profound impact on the entire scientific community.
And from Lieutenant Governor Kathy Hochul, New York State is using data and science to fight COVID-19, and it is working because of research institutions like the University of Rochester. The University of Rochester is home to world-renowned medical and public health experts who are at the forefront of tackling this unprecedented pandemic. And I recently witnessed firsthand the leading research being done. Today's commitment from the National Institutes of Health is recognition of Governor Cuomo and New York State's investment in public health and ongoing support of URMC's Clinical and Translational Science Institute. These quotes all demonstrate how the COVID-19 pandemic has thrown biomedical research and institutions like ours into the spotlight. But our work has always been important. In fact, our CTSI's past 14 years of work were pivotal to the university's ability to shift on a dime to address this pressing health crisis.
Before COVID-19 forced many around the world to stay home, the CTSI was working on ways to bring research to the community to meet people where they are. Improving our ability to conduct research remotely, over the phone or through video conferencing, cuts travel and parking out of the equation, which were always a barrier, and will help us reach patients and study participants who are quarantined at home. Pre-COVID, our intention in enhancing remote research was to help more people and a more diverse set of people, all of us, to participate in health research. Now, remote research capability is critical, absolutely critical, to being able to conduct not only COVID-19 studies, but all clinical research during this time. With our new funding, the University of Rochester CTSI will further reinforce the university's ability to conduct research remotely and will develop a research bus that can bring the clinic and the research study to participants in their communities and their homes. These remote research efforts are just a few ways of how we hope to ensure that our studies reflect the diversity of our communities, that all can participate in research. Being virtually and physically present in the community with appropriate safety measures will help us address health disparities during this time and beyond, and ensure that therapies for COVID-19 and other medical illnesses work for everybody. With continued funding for these efforts, the U of R CTSI will ramp up our efforts to connect with communities that experience health disparities and that are typically underrepresented in health research, including Black, Latinx, pediatric, elderly, deaf, and rural communities.
Research without walls also means breaking down barriers within our university. Despite close proximity, biomedical research and clinical care can often feel worlds apart. Research advances like vaccines can take years to be scaled up, distributed, and fully implemented in clinical practice. And it's an even bigger challenge to ensure those advances are equally accessible to all members of our communities. For the past several years, the CTSI has been working toward developing a learning health system in which the research and clinical enterprises are aligned for continuous improvement. Over the next 5 years, the CTSI will continue this mission to connect researchers, clinicians, and diverse community members so that they can work together to identify health challenges and build solutions that are responsive to community and health system needs. These teams will need to not only create a drug or vaccine, but also have an eye towards how these products can be adapted and adopted by communities and health systems. You can create a miracle cure or vaccine, but it won't save lives unless people are aware, have access, and are motivated to use it.
Beyond connecting the people behind research in medicine, the U of R CTSI is also actively working on integrating data from each of these realms. The recently launched COVID-19 Biobank is just one example of this plan in action. The biobank and its team enable researchers to share COVID-19 blood samples that are linked with relevant lab and patient data that is de-identified and secure. This saves time and effort for researchers, gives them a broader view of the COVID-19 situation, and may help them connect the dots that they might not have otherwise seen. The new grant will allow us to continue these efforts, building a research data warehouse that will seamlessly and securely integrate all kinds of health-related data, from the electronic medical record to genomic, biospecimen, laboratory, and other clinical data. This data warehouse will also provide an array of analytic tools that will help our researchers stay on the forefront of biomedical research.
Before we open up for questions, I wanted to reiterate how much we appreciate our CTSI team and our many community partners. This is truly a celebration of their efforts and their success. It turns out that our very scientific CTSI staff members have a creative and lyrical flair. So we asked them to tell us what the CTSI means to them in a haiku. Here are a few of our favorite entries. From Seihan Sazon, UR CTSI, supporting advanced research collaboration. And from Elena Moriano, still working from home, I miss you all so darn much, but man, I hate Zoom. And from Colburn Jerry, connecting us all, our strands remain unbroken, standing together. And finally, from Anonymous, another 5 years of pushing research forward. Cheers to our success. Cheers to all.
Okay, so now we can open for some questions. And one of the questions that we got was from someone in our Q&A. They said, you said the grant renewal was a major undertaking. How big was the team and how big was the application itself?
So the grant took over a year to write. We had a team of over 50 people, and the entire application was 1,996 pages. Pretty large. The team was amazing. Nana and I stand here because of the efforts of the amazing CTSI team and those in the University of Rochester community who helped us in this endeavor.
And another one, maybe Nana can answer this one, or either one of you. Does Research Without Walls allow for a change to the university hiring freezes for positions that can be performed remotely?
I'm not sure I understand that question exactly. We do have a hiring freeze right now because of the significant economic issues that the university has experienced during this time. However, we are still continuing to do research. We are doing research on site, remotely, through data, but also in the laboratory. So research stopped temporarily, but has now been reinstituted pretty fully. And of course, during that time, COVID research started and has been moving forward very quickly and very successfully.
And to address the hiring in the midst of the hiring freeze here, research on COVID and research without walls, in fact, medical research is an essential function. And so where needed and funded by the National Institutes of Health, the Centers for Disease Control and Prevention, and other agencies, we do have the ability to ask for, and many research programs have received permission to hire essential researchers to work in the field with appropriate protections or to engage in remote research.
Okay, we have two more questions. Will the data warehouse project bring more jobs to the CTSI?
I'll take that one. Absolutely, not just to the CTSI, but to the University of Rochester in many ways. As we have all been made acutely aware, data has become the currency of scientific research, and data not just about what happens in the lab, but what happens in our community. The research data warehouse will give us the ability to do integrated research, more of it, and to be highly competitive for more research grants, as well as spin-off research on delivery of healthcare and dissemination and implementation within our medical system. So now and in the future, the research data warehouse will result in more jobs at the University of Rochester and in our community.
Follow-up question to that. Will this data warehouse house data from all of the CTSIs as a hub, or just our research? So all CTSA hubs, or just our own hub research?
That's a great question. So this data warehouse will house data just from the University of Rochester research endeavors at this point. We are, however, connected through several national efforts with data warehouses that share anonymized data from the University of Rochester, appropriately approved by our Research Subjects Review Board. One of those data sets that we are actively participating, called N3C, is a national database with contributions from all of the clinical and translational science award hubs of data regarding COVID-19. And we will soon be announcing how researchers from the University of Rochester may get access to that data set.
Okay, there's only one question left in our feed here. So we talked about how the CTSI is built to help to support researchers across the university. How can investigators find out how the CTSI can help them with their research?
So many ways. The first is go to our website and contact the Research Help Desk. That is the portal for finding out what resources are available. And the second way is talk to somebody that you know that's involved with the CTSI. And specifically, if you have questions, please reach out to Nana and I if we can be of help. We are here to serve the University of Rochester research community. Nana, did you want to add anything?
Yeah, I think that's the most important. Go to the website, go to the help desk, but we are always available to consult about whatever particular needs you have. The CTSI has many, many resources to support investigators, and they are all available, and we are pretty good at navigating and helping you get to the resources you need.
Nana, I wonder if you have, we're just about at time for our conference here. I wonder if you have any final thoughts you want to share with the audience about this news today.
I think we're just so excited and so proud of our team. As Martin and I both have said, this is a huge team effort. We're very lucky to represent that team publicly, but we know very well that we didn't do all this work. Our team did all this work. And in addition, the investigators at the University of Rochester do all this incredible work day in and day out. And we hope that everyone will recognize how important research is to our mission as a medical center and how much we need to support our investigators to ensure that they are successful. It is not easy to do research in this environment. It's very complex and people work very, very hard. And it's really, I think, a calling for the CTSI team to try to make that work easier for all investigators. And then, in addition, to really contribute to improving the health of our community. That's what we're here for, finally, is to make people healthier.
We are proud to be the stewards of these resources for you and our community, and to help all of you make a difference. Thank you.